Alright, buckle up because I'm about to do a deep dive of the privatization of the Canadian healthcare system. Let's take a look at all the facts, shall we? So it seems as though the federal government is finally starting to crack down on doctors charging for medically necessary healthcare, which is something that's been happening across the country. And this includes clawbacks from health transfers when provinces enable this behavior. Because I don't know if you know this, but currently in pretty much every province in Canada, the provinces are enabling the privatization of healthcare. And they're also destroying the public healthcare that we have by allowing or really forcing staff to work outside of their regular responsibilities, meaning people who aren't trained for certain things will be forced to do certain things, without getting paid more for it, mind you. And this will ultimately put patients at risk. How about this insane deal at an Ottawa hospital? They've signed a deal with a corporation of private surgeons to use the Ottawa hospital's publicly funded operating rooms that are currently not in use because we don't have enough staff. So the excuse is that we don't have enough staff to use these operating rooms, so instead what we're going to do is we're going to pay doctors more money to do private surgeries in these operating rooms that they could have done anyway? They are literally lying to us and stealing taxpayer dollars. And the feds are also looking at cracking down on charging for virtual healthcare. This comes in two forms. First off, in many provinces, including Ontario, doctors can now charge you for an appointment that's virtual. Which, like, what? It's healthcare. It's covered under the Canada Health Act. They can't charge you for healthcare. And then beyond that, we have organizations like Maple that connect you with a doctor that is outside of your province. So technically, they're allowed to bill you, even though, that's still in violation of the spirit and the purpose of the Canada Health Act. People are saying that private for-profit clinics are going to save taxpayers money and reduce wait times, except all of the data says that's not the case. And not only that they don't do those things, they also increase the death rate, which we should already know from long-term care, considering that the majority of people who died in long-term care in Canada died in for-profit homes, where the military had to be called in to deal with things, and some military personnel are dealing with PTSD from the insane things that they saw, people starving and dying in their beds covered in their own feces. Like, for example, a knee replacement surgery at a public hospital paid for by the province would cost about $10,000, but the same surgery in a private clinic would cost patients up to $28,000. This is where the for-profit part of our healthcare comes in. Can't believe I'm saying there's a for-profit side to our healthcare. And when the province pays for a knee replacement surgery in a for-profit clinic, the amount is kept secret, which might be why Doug Ford is changing the Freedom of Information and Protection of Privacy Act to make it so that we cannot get information from these private clinics, making it impossible for journalism to occur. And also, in Ontario, we had the shortest wait time out of any province in the country. But Doug Ford thinks that we have to start emulating what other provinces are doing to lower our wait times, even though it hasn't worked anywhere else in the country. Because while 73% of people in Ontario get their knee replacement surgery within 6 months, in Alberta it's only 53%, and in Quebec it's 48%. And research from the US and the UK show that private healthcare increases additional deaths, which is why we need to protect public healthcare in Ontario. We need to force the federal government to step up and enforce the Canada Health Act.